View, you remember up there I drew that? All right, so with the leg here, think about the upper body as one side there, and the lower body from the leg down as the other side. Oh, that's extended. It's one of those things you have several classes once you're in OT school that will reinforce this for you. This is kind of your initial reinforcement. Make sense? Cool. Every time you go to do something, if you draw out two pieces, okay, and label them with whatever it is, this could be fingers, hand, all of a sudden extension and flexion makes sense with angles. Okay? Well, we have a lot of material. God. Here's the easiest part. Peripheral nervous system, central nervous system. Yay! I am going to attempt to make more than half of the exam multiple choice. The rest might be a labeling exercise, or I ask you what I would like you to label on something. So I might give you a drawing and say, you should be able to, label these 4 or 5 items. Okay? Things like that. If I do it right, I might have arrows and things even on some of them. I might give you, as I said, we might have some little short answer things or a fill in the blank. More likely, I'll give you a drawing, and I'll have arrows pointing at 4 things and say, what is this? What is this? What is this? Don't worry, the goal here is not to throw you in a blender. The goal here is to actually see what you know reasonably. This, is your basic lateral view of the internal part of the brain. All of these names look really complicated. They're really easy when you sit down and think about the roots of the words that go into them. They're not that tough. You should be able to label a lot on this. This, as I said, is a nice figure for you to work on labeling. Just the overview of the spinal cord. Wow, we've got the cervical region, thoracic, lumbar, sacral. This isn't bad. This is, once again, pretty straightforward. Regions of the brain. Here we go. Wow, you go. I just asked you a question that incorporates this with something else. You remember? I said, oh, you should be able to show me this fissure, this sulcus. You should be able to talk about the lobes within here. That would be a good question, by the way. This would be a nightmare. Okay, honestly, how many of you feel you could do an adequate job on labeling that? Okay, 1 of you, 2 of you. All right. This, you have to work at learning. That's all there is about it. You have to know this in the future. All right? We are going to be going to bits and pieces here and there. We're going to talk about problems. We're going to talk about stuff. At this point in time, you should be able to label a lot of that. If, maybe not all of it, but you should. This is going to be in your, if not immediate. No, it's not going to be in your immediate future. I wouldn't give you that to label on this exam. However, every structure in here that we have already talked about, I'd expect you to know how to find. This sulcus, these gyri, yeah, you got to know those. How many times have we talked about them? I don't know, 3 or 4 times already. Oh look, primary vision, primary auditory, primary somatosensory, primary motor. Well, there are only a couple other ones that we haven't, that are not there. This I expect you to know. That's it. If I ask you, So, I mean, I could ask you a question. I could say, so, your patient has a lesion on the lateral somatosensory cortex. Which of the functions below do they lose? Lateral, over here. Oh, well, that's motor. Lateral, over. Oh, look, it's almost the same thing. So what do they lose? They lose their... I would not... I really, you know, like right here, what's lateral? Essentially, almost all of this is lateral. His butt is sitting on the superior. All right? So you should know medial, superior, lateral. Yeah?
I'm remembering this correctly, but in the textbook, I thought I saw when I was talking about this, it was like a mnemonic that you can remember, is that the arms are medial to the legs or something.
Yeah, you know, I don't remember the mnemonic for this one. It's one of those things, what's going to happen is once you learn it, you're going to just remember. In the somatosensory, the important thing down here is that you have organs. Everything that's inferior is inside. As you work your way up, you're going, and it works sometimes, sometimes not. You're working up the face, then you're out at the hands, you're working into the body, and you go from the hands to the torso, down to your toes, and then to your genitals. So, yes.
Sorry, so if you had a lesion on the superior part of your somatosensory, would you say like...
You know what, if you could, I mean, number one, it's going to be multiple choice. Okay? Here's what I would do. If you're going to see a question about the homunculi, you go, uh-oh. I encourage you to write and draw on your exams besides giving me answers. Hand, arm, torso, thigh, leg, foot. So, you know, you can just work your way around. Jen.
Thank you.
So, bless you.
Yeah.
So, all right, so you can, first thing I would do in attempting to answer something like this, once again, be able to schematically draw it out. You know, it's like with mnemonics. This is gorgeous. Students that do mnemonics, I mean, I love it. I know a few, not a lot. I'll ask a question on cranial nerves, and the first thing I see is students writing the first letters of the mnemonic, or they write the mnemonic out. And I go, okay, they get it. They're working at it. So I don't recall the mnemonic off the top of my head because I never learned one for this. I was one of those stupid people that just looked at the picture and said, oh yeah, that's how it goes.
I just
So.
don't, like, understand it. It's like the arms aren't actually medial.
The arms are lateral, okay? Yeah, and the arms are lateral.
Right.
So they are lateral. The torso's superior on both sides, and the legs are medial. So if you're in anatomical position, the legs are indeed medial to the lateral arms. And if you're not in anatomical position, they still are. So, whatever. I really believe with anatomical position, you know, anytime you're confused, you can do it while you're sitting down. You can go to anatomical position and just think about it. Yeah. Yes?
Do you mind going over this one more time?
Sure. Like,
because I know when I was looking over it myself, I was confused.
confused.
Yes.
Yes.
So I
Okay,
better
no.
get
This,
straight.
by the way, this is when you're supposed to be asking questions, okay? Reviews should be driven by, you know, you're at the steering wheel. All right, so, This is a somatosensory cortex. This is a left somatosensory cortex. This is a right somatosensory cortex. Left motor, right motor. Remember, on a brain, you've got a left side and a right side with the cortex. Now, if we slice through here, so I am now separating this into its components. Let's look at what's along here. This is the superior aspect. What you see here is this. Okay? Now, this continues, yeah, right, in there. So as we pull it apart, it wraps around. So this is that central sulcus. Here we have your genitals, your foot, your ankle, your thigh, your knee, calf, thigh, knee, torso, upper arm, forearm, wrist, hand, thumb. So that wraps around the superior part. Come on down, we now have the face. So what this is telling you is that when you touch your face, okay? So I'm touching my face right now. Do I know that I'm touching myself? And the answer is yes. How do I know? Because when I touch myself in my cheek here, the signals come through to this part of the cortex saying there's somatosensory input. So does that help with that? Now, I get slapped. Never happened in my life. Take my head back because I felt pain. For my head to move back, all right, there's going to be motor activity. Actually, the motor activity is going to be right here for the most part, which is going to move my head in this direction. Might move it in that direction, whatever. But now let's say I've touched something that's not pleasant. It's neither hot or cold, it's gooey, okay? I get a signal to my hand and fingers here that says, ooh, that's gooey. Take it away. But when I take it away, I'm not moving my hand, am I? What am I moving? My shoulder. My shoulder is retracting my arm. So that's going to happen up here, the response. Does that help? That's how you should think about it, I think. So, we have two homunculi for somatosensation, a left one and a right one. We have two homunculi for motor outputs, a left one and a right one. Does that help with that? Does that?
Oh, yeah.
Okay.
Yes.
All right, cool. Oh yeah, here's the big guy. Oh, I'm sorry, it's just like we looked at before. It's in color. It's pretty. What's this? Oh, Broca, Wernicke. Cool. Primary, oh, this has lots of numbers on it. So far, we haven't touched on most of these numbers. We're not going to worry about them yet. All right? With the exception of area 4. What do you think area 4 is? What's area 312? There you go. Okay. This is a really nice, I'm sorry, I keep pulling illustrations in from lots of different books to add to what you have, but there are some illustrations that are superior to others. This is a really nice one. It is packed with information. Okay? We've got the central sulcus. Oh, then we have the precentral gyrus and the precentral gyrus and the postcentral gyrus. Okay? So we have the gyri in there. We've got the prefrontal cortex. Prefrontal cortex is going to become really important as the semester progresses. This has many of the special senses label